Hi, I'm Dr. Meier from Third Coast Foot and Ankle, and I'm going to answer that question today about what will happen if I let my Achilles tendon pain just live with me. So sometimes when we're dealing with a really frustrating injury, we learn to accept it. And there are consequences to that. Some injuries, that is what we have to do, and there's a certain amount of pain that is with us forever. That is not the goal always. And with Achilles tendinitis, we want to make sure that we're not overlooking pain that could actually be very serious or detrimental. The most significant consequence of ignoring an Achilles tendon pain is an Achilles tendon rupture, meaning that the entire tendon pops open. That can be a very devastating injury, which oftentimes requires or leads people into surgery. Now, the reason this is relatively common for chronic Achilles tendon pain and injuries is because when the Achilles tendon is injured, it's actually tearing and causing a lot of inflammation, which creates a lot of scar tissue. Scar tissue has really no flexibility, and so it can't stretch when a lot of strain or stress is being put on it, and so it starts to tear. When it starts to tear, it kind of starts that process all over again where more scar tissue builds up. So over time, we can actually see enlargement of the tendon. It will look like a bump or a ball of the tendon that can be directly over the bone or in the tendon itself. Sometimes we mistake this for a bone spur. We oftentimes see bone spurs on x-rays with chronic Achilles tendinitis, but this change in size is not really related to a change in size of the bone spur. It's actually the tendon getting thicker and scarred down. Now, when we encounter this, it's not game over. There are techniques to actually decrease that scar tissue and make the tendon stronger. Sometimes we do resort to surgery, though that is not my preferred way of treating this, because there's a lot more non-invasive treatments available to us now where we're using regenerative medicine to actually recreate and regenerate that tissue at the same time of decreasing your pain so you can continue to be active. So at Third Coast Foot and Ankle, we offer things like laser treatment, shockwave therapy, and PRP injections, which have proven success to decrease pain. We also do offer surgery if those options are either not good for us or are not producing the results we desire. So if you are struggling with Achilles tendon and you're at that point and you're wondering, should I just live with this? My advice would be don't. And if you have more questions, please reach out to us at Third Coast Foot and Ankle. I'm Dr. Lucy Meier. I'd be happy to walk you through the expected normal pain and what we really want to make sure that we're treating and getting rid of. If you found this video helpful, I would really appreciate it if you liked and shared it. That helps us out immensely here at Third Coast Foot and Ankle.